Let me share my talk. Right, so we're back again to the topic, hot topic of the day, development, child development, but we will go back from a different direction this time. And I plan to go large and then get small. So initially I'm going to talk about the modern understanding of child development and the impact of these important topics globally. And then I'm going to focus on the child development in clinical practice. And eventually we'll finish by getting some cases shared with you. So let me just put that one. Okay, so let's see. Okay, so let's start by the credit goes for the advanced researches and the neurosciences, which is make the whole world, especially the WHO with the UNESCO, give more attention to this very important topic and try to put heavy money in exploring more on the child development. Many of you remember when we were children, the child development means that preschool, it's mandatory you get your height checked, your weight checked, and your skin fold checked. So to maintain, just make sure that you are really healthy and in a good condition to start your school. But that's completely changed now. Child development, it's vast, more extensive than what it is now. Is the health cognitive and health physical and health emotional child. It's affecting the children hugely as an individual in the future, but also affecting their family and society and the community at community level as well. When we talk about child development, we mean from birth to 8, because this is where the critical time, if there's anything influencing a child development, it will be within that age and time. Child development, there's a many definition for that, but they all comes into the one standard. It's basically the sequences of the physical, biological, emotional changes the child goes through from birth until adolescence. And this is which move him from totally independent individual into gradually into fully dependent adult. However, development never starts at birth, it actually starts before birth, specifically the sensory senses. These are the tools which make the child able to identify the surrounding and the environment, and through which he can be reassured, well, he can get into the optimal development. The maximum development time is actually within the 5 years of age, first 5 years age. So this is a really sensitive time where the very much of the life experience the children will get in. However, after that time, the brain continues to develop until 18 years of age. This is to make more extensive experience, but does that stop there? No, it never. After 18 years of age, continue brain development is there, but the rule is different. Now it's a maintenance rule only, means that keep the brain able to regain or restore ability which has been lost. And for that reason, we are still able to learn, and we're still able to change our way of tolerance of things and change our life decision easily. There are 3 factors which determine child's development. The most important one is the genetic. This is give the blueprint. Environmental factors so important, and the maternal nutrition as well. I will summarize the UNICEF and the WHO long years of 4 decades of researches on child development in this slide, which is I got it from the UNICEF website. This is what has been thought it's a fact before or yesterday, now today it's a lies. Now the first very important thing that the brain development depends on genetic only. No, it's not. It's actually so complex relationship between genetics and environment, and basically experience of a children in the very early age has a very strong say in the way they're going to be present themselves in the future, and also in their abilities in the future as adults. The second old say that experience before 3 years of age, all is forgotten, has nothing or has no impact at all on child development. Well, what make the child nature, and what make him the person an adult, as an adult in his abilities, actually the experience you go through in the first 2 years of life. The third one is that the security relationship between the babies and the mom, we usually say, but now we say caregivers because it can be rather than the mom, is important context for the early development training. It's more than that. It has a very direct effect on the way the brain wiring itself and in the way the brain develops. That's very important and essential. Children learns less than adult. Ability to learn from children is less than adult. This is totally a big lie. A 3-year-old child has a twice ability of teenager ability to learn. Ability to learn, it doesn't mean what he's going to be learned, but they can learn so quickly. They can learn many things at the same time. The brain is the most activity at this age of 3 years of age. And finally, brain development is a linear, means as the child goes older, he's able to learn more and he can get more. No, it's not. Unfortunately, it's a curve, and some of it is actually a dome shape like this. Now, this is what we call a sensitive period, means each of these abilities or each of these development domain has a time period where it's a maximum ability to learn. If the child was not exposed to the enough stimulating during that time, then he will be having a problem in this developmental area. I'm just going to give you one example here. If you look at the language, which is the orange line, it's starting from birth. So language start at maximum level. Learning of the language start at maximum level from 0 time. And this is why we tell parents, always talk to your child, always listen to your child, and always, sing and talk to your child during that time until 2 years of age. And after 5, it's gradually grow down. People who deal with a child speech, they know the children after 5, their ability to learn languages is really less. We as adults also, we know that learning languages is much easier when we are younger than we are older. There are 3 factors which is influencing development, and they are important. Now, we talked about maternal nutrition as the main determinant of the development during pregnancy. Nutrition after birth, it's so important and essential factor. We're talking about zinc, we're talking about minerals, we're talking about the iron specifically. Psychosocial stimulation is so important. It's a stimulating environment which make the child able to expertise interaction with the direct environment, and this will basically help them to develop very well. And the stress, chronic toxic stress, it's very important, affecting the child's development, it's affecting his concentration and ability to focus in the future, it's affecting his learning ability in the future, it's affecting his emotional regulations in the future. Now, these 3 factors, they have a direct impact on the brain function by the way it's affecting its wiring. So it's not an indirect faction, a direct effect. It's actually a very direct influence and very strong. In 2007, the WHO with the UNICEF, they released a very important series, 3 series actually, looking at the developmental potential in the children in the developing countries. So that's related to us basically. And what they found, more than 200 million children under age of 5 in developing countries are not developing to their potentials. What that leads to is actually in our countries estimated 20% loss of our productivity. Now, how that affecting the children? No, the children, when they don't work with their potential in preschool and school age, they usually do poorly at school. Subsequently, they will have usually low income. They are usually having low fertility rate. They are basically live in a very bad economic status. Now, the more serious these generations is able to transfer the poverty to the next generation, and just we goes into a very cycle. The second series, they basically looked at what are factors which is affecting the children's development in our developing countries. And there are 4 of them. Now, 2 of them is related to where you live and, geographically, and also in the economic status, socioeconomic status. So malnutrition and also iodine deficiency. But iron deficiency and inadequate cognitive and social emotional stimulation, that can be anywhere, and I don't think it's linked to the basically to the socioeconomic status. I think it's more linked to education and awareness of the parents of importance of nutrition. There's 2 more factors which can affect child's development, is the maternal depression and the violence exposure. The third development paper or series is actually, it's where they put the strategy and the guidelines for the countries trying to develop what we call is the Early Child Development Program. This program is, they put only the strategies, but they highlight the importance of what exactly need to be looked at or what exactly we need to be doing during that time. Antenatal care, screening program, which is development assessment, will baby clinic, early learning centers and toddlers, enrolling to a nursery from early age, preferable 3 years of age, and also reaching out facilities and service, early development program for the special children with the special needs and disabilities and children of determined, it's so important as well. Now, the very important about this program is actually it just put the outlines or how different systems within the government and out of the government working together, talking about civil societies, governmental institutes, schools and education sector. We're talking about also as health sector, and in addition to the families, working with the families. Each country has made their what we can say framework for this working, and there are many countries in Colombia and other American Latins has a very successful experience adapting and implementing these programs. Now, what's the benefit of these programs? The main important things that we work with the children when they are preschool because we want them to have improved school achievement. We want to reduce the dropout rate and the repetition rate at school. We want to be having in the future a very great adult productivity and reduce this 20%. And the very important, we want really able adult with a high level of a social and emotional function. Now, this program is very expensive, but it's a cost-effective program because the more you're working towards strengthening the society by making the individuals or adults are at their best potential and pitch working, which and in the future is basically it's earning of money rather than spending money on supporting the children with disabilities or children which is function lower in the community. Let's go back to our practice in life, clinical aspect of child development, right? Now we learn about what's important or why it's important this is child development. Let's go back into our practice. What's the normal development? Normal development means approaching milestones within identified period. If you want to remember that curve there. So what's the milestone schedule? Everyone knows it. It's gross motor. It's a fine motor, speech and language, including hearing, social interaction and communication, and eventually is the vision. What's the problem? What's the etiology of the normal child development? Why the children might develop or might born with it or have developmental delay later on? The vast majority is not known. Now, if you remember, with Dr. Ayman, 20% maximum can be genetics, 1 to 3% between the metabolic and between other maybe conditions, and lacking of environmental stimulating. So if you look at that one, it's probably 1/3. We know the reason, but the vast majority doesn't know. We don't know the reason. The second very important is the genetic. And if we mention here, importantly, the metabolic, obviously, and the genetic, especially the epilepsy. Congenital, maybe because of perinatal infection, because of a nutrition, toxins and drugs mother is taking. Neonatal complication, HIE and the prematurity, and finally environmental, and this is the vast common, the lack of stimulating environment and exposure to the chronic stress, child abuse, parental education, especially mother side, and the economic status. What's abnormal development? There are 4 types of abnormal development. Either the child, okay, before I start saying that, let me explain to you the sequences of development. Is actually the vast majority of most of the development, children development, it's sequences which is one step depends on one another. But there are another type of development, some of the child development is actually a new stage, so it's not dependent on each other. So when it is dependent on each other, that means the child cannot do one step of development before he got the other one. A very simple example, without a baby or an infant able to sit independent, with a straight back, with a good control of the neck turning right and left, he can't be able to stand alone, and then he starts walking. So this has to be in a sequence. The second example, if a child cannot balance his feet when he walks, the second step of walking, wide walk and then straight walk and then bend down to pick up something. Now here, that means he starts to balance his gait. Then he can move on to the 6th step, which is jumping off the ground and also going upstairs. And these are sequences, has to go in the sequence. So the children who are still on track, they will do exactly the same normal sequence of development, but they are slow. So instead of he sit at 6 to 9 or 8 months, he will sit at 1 year of age. And instead of walking by 18 months of age, he will walk after 2 years of age. Stop progressing. This is very important. That's a plateauing, or sometimes also regression, which is down below. That's losing skills. Stop progressing. This is important because it's so much linked with the epileptic syndromes. Rat syndromes, other syndromes are related to that. Regression, again, it's linked to the epileptic syndromes and metabolic syndromes, and it happens also sometimes in acute brain insult. But with acute brain insult, good percentage, they will recover again and regain their ability. Off track, what that means. Child is walking, but his gait is not normal. So he can do it, but the quality is not the right thing, or the quality is not the one which is expected for his age. So here we are, the four of them. Why the abnormal development is so important? It is an indicative sign of a chronic insult and conditions affecting brain function. Basically, child development reflecting what your child's brain can do. What the brain function can do is so much reflecting the neurological condition and the neural condition and the neurological ability, metabolic conditions and disease, prolonged sickness, multi-system sickness conditions, and neurodevelopmental disorder. So this is why the screening and assessment of child development, it can give us a very good clue about the children's sickness. It's not only to implement the early intervention, but so important to go to the bottom of what causing this problem, because early intervention, not early intervention, early diagnosis and putting the right to proper management can make a difference, a huge difference in these children's life, as we will see later. What are the methods of clinical assessment or child development assessment? Well, there is informal one, which is very common, and this is by direct observation. This is, we do it in a clinic, and we do it, basically people do it in the nurses and in school. Collecting data about the child's ability to walk, obviously within a frame of his age, and getting a portfolio of that. Using the educator and teacher rating, this is number one. The formal assessment and using the tools, which is using the tools such as questionnaires and standard testing. Now, I have to tell, very important, none of these two replacing each other. You have to get 30-60 degree of the child's ability. So questionnaire, it gives a very tunnel vision on the child's ability. Development assessment clinically is and it's a must, especially clinical assessment, diagnosis, and neurological, including a neurological examination is very essential to know and to basically guideline you to what could be the cause and before then what kind of investigation you should go for. There's two types of the formal assessment. The one which is the program developed child assessment tools. Many of you parents have seen that in the nurses. So what they do, they put a program for the child's ability according to his age function, and they see whether that child is meeting the goals or he actually needs to work on. This is generic and informative, but it's not very much helping in a term of finding basically a cause or a diagnosis of a child is a problem. The second one, which we like to go for and which we love to use, is the child assessment tool, which is a published, researched tools, and it has the credibility of more accurately getting the weakness and the strength of the child, the child, and more than that is also in giving a clue on a diagnosis. There's many of them here, ages and stages, you know that. There's also the schedule of development career skills too. There's a Griffiths, there's a Bailey and Bailey 3, there's a Bailey Infant and Bailey 3. I think I just got to know from Dr. Fatima from Dubai that they also adopt something called BEAM, which is can be trained. You just apply for it and you can be trained as a screening tool for the development. There's more than 50. So it doesn't matter what tool you use, as long as it is valid, it's reliable, and you have the expertise doing it. This is the very important three things. How we assess the important about assessment development. There is a fact about development assessment. It's not a straightforward tool, and there's a lot of pros and cons about it. And therefore, you cannot depend on it on its own. You can't depend on the cheat marking, or you cannot depend on the test you're doing without looking at other aspects and other questionnaires and information. Number one is a snapshot. So basically, you can get it from a very nice corner, and you can get it from a dark corner. The second, it's not objective at all. Even if you have steps to do the test, is actually how you interpret the response of a child, or the action of the child, or the quality of the result of the test is very important. So it's so much subjective test. It's an art, because getting information from a child at that young age is not an easy thing. You have to get the child or provide his best during that session. Art of observation, we do a lot, but I think is the main and the most important tool is the observation, because through the observation you are able to interpret the outcome very correctly and very accurately. It's so much dependent on the way you approach on the child and building up. You may get a child, but he didn't like you, so what you will get may not reflecting him at all. But you may get him on the wrong time, so it may not get reflecting him at all. So approaching, really making the repetition with the child is very essential, enable to have a successful assessment. And the other thing is very important, taking into account the clinical picture. It's so important, the information and the clinical picture of a child. It's a cycle. So first of all, you decide what kind of, how you're going to start your assessment. Getting more information, getting questionnaire, setting up or decide what kind of the tools you are going for, and whether you're going to do it yourself or you want somebody else with expertise with a different assessment tool, you do it, they can do it. Another tools which I forget to mention, the WISP is actually one of the tools, and also the WISC-5, but this is WISC usually, and 4 goes more than 6 years of age. Once you have this assessment, you need to observe exactly what is the child, how the child did, and how he ran the test, and how he interact, and what he was responding. Documentation is a very important thing, and it's so accurate, detailed documentation, because depending on this documentation, you're going to make your analysis and evaluation, which is the most vital step. The analysis evaluation, highlighting what could be the reason, what you think you should do for the child. That has to be summarized and planned and adequate and communicated. Now from here, I wanted to make very clear that no plan is the same. Every child his own plan, every child his own route of investigation, and he has his goal really for what we should do for him. There's nothing called universal referrals or universal early intervention plan. Once you did that, you will go back again, you have to review that after some time and see what's the progressing. The main thing is that highlight the weakness of the child, find the potential of the child and make them better, get a diagnosis for this condition, because if there's any clinical intervention, you must start it as early as possible. We're talking about the enzymatic defect, we're talking about genetic disorder, we're talking about the chronic systemic disorder. Practical examples, right? Let's look at some of the practical examples, and I decided not to give you the story. I'm going to tell you the story, but I'm going to show you some of the assessment results. So this is a 25-month. I cannot forget him. He just come exactly before Corona time with the panicking parents. He was referred because thinking he might have autism. There's 3 important things. He's 25. He does not say any word. He does not interact at all with any one of his siblings. And lastly, he has a very poor responding to talk and responding to calling by name. He came for the assessment session with his father, and he was really difficult child. He settled only for 10 minutes, but then he's so clingy, he's so attached to his father. The following observation I got from him, that he can interact with his father. He did interact with me only for a very, very brief time when we tried to playing a ball. He basically was approaching father to put hands up to be really picked up, and he has a good eye contact. These are the only non-verbal communicative skills I can pick up at the time. He wasn't using finger to point with finger, although there's many times when there is a challenging that, yes, you can point, but he wouldn't do that. He didn't speak any word. He wasn't following instructions, waving the symbol ones. He doesn't respond to his name, and he doesn't give attention to whoever talking to him. He did initially once smile. So at that time, to be honest, I mean, yes, differential diagnosis can be autism spectrum disorder, but to me, there was a few tiny things which made me feel like, okay, probably he's not the one, which is I'm going to go straight away to assess him for the autism spectrum disorder. Now, I believe that everyone knows the importance of assessing for autism spectrum disorder as soon as possible, because you don't want them, you don't want to lose the time, precious time before 5 when they can catch up with their development. But with this child, because of the variability in his interaction, because of the inconsistency in using the verbal, and because of the background, which I know that he's the youngest of 9 children, they're all older than him in a good number of years. He doesn't have the best attention at home. He's on the screen most of the time. And if I can say, there's a huge lack in the social stimulating environment. So we decided, when I discussed with the parents, we'll keep very close monitoring. I mean that 2 to 3 month review, but at the same time, immediately change the whole environment into more stimulating environment. We'll put him more into towards kids of the same age to pick up and learn the language. And at the same time, maybe we can start speech and language therapy, but we depend obviously more on the parents is changing the whole home environment. We keep monitoring that child, and this is, if you look at that one, this is his initial assessment. This is when he came to me 25. If you look at here, this is the gross motor. He's doing fine. He's age appropriate. Fine motor, he's slightly delayed. I will say I wouldn't focus on this because I know most of our children, they are not really here. And the third is self-care, which is again very good. It's just a mild delay. Interactive social, that's because he has good play skills during the assessment, but his interaction wasn't optimal, according to the parents from the history and what I have seen. Now, the 3 areas here, these are the very important areas. This is hearing language and following instruction, obviously. This is, this is the visual awareness or visual intelligence, what we call it, ability to be aware of the surrounding. This is the hearing language, ability to respond to the instruction and understand the instruction. And the third one is the speech and language. Now, from my experience, I got really scared when I see this triad all together, because many of the children with communication disorder, they present just that way. It doesn't mean that everyone has that way, but just like this. But because I have seen this child in clinic, because I've noticed few tiny things, I didn't say that, well, this is maybe autism spectrum disorder, we'll give him a time. I saw him again physically, but we've been in touch with us together at 34 months of age. During that time, I was so thrilled with the way he was progressing. And now look at him. He's age appropriate in his gross motor, fine motor, and actually he did very bit high score. In his visual intelligence, this is the third one, look at where he is. He's actually advanced. And he's doing very well in the hearing and language. And he does very well in speech, will develop very good. And again, in the social interactive and his ability as a child. Look at my description of that child. He was a sociable, active, interactive. He was happy, enthusiastic about table activity with it. He knows his routine. He follows instruction and shows good focus. He demonstrated appropriate social and communication behavior using verbal and nonverbal scales. He copies action and words and responds to tease. He interacts and shares enjoyment and drag attention. He's right-handed and he has mature pencil grasp, and he follows simple instruction, as I mentioned. Now, I'm so thrilled. He did it very well. Parents were excellent in following the instruction we did, changing the whole environment around him. So we stopped there. Did I discharge him? No. The reason for that, okay, we overcome the problem we have that time, but I have to make sure until he got into the school, we are not basically facing another developmental disorder which can be settled and appears only when he enters the school. Do I need to see him often? Well, 6 months here to 1 year. That's it. And we may repeat another once after 1 year at development assessment and a more detailed one using, for example, Griffiths, and then we look at that. So that is Sultan. The second one is another case, which is a very,
we are running out of time.
Sorry. Okay. Can you give me just 3 minutes? I'll go very quick.
Okay, 3 minutes.
Yes, please. They are just important cases. Now,
Thank
this is
you.
the baby. She was referred to me about 12 months of age. She's a preterm baby, born at 24 weeks gestation, and she was referred because of the global developmental delay. Interestingly, looking back into her note, she never had this stormy neonatal period. She was discharged after 6 months, but she never had a huge major complication. During the assessment in the clinic, what I found that she's so hypotonic. She's so floppy and she's globally delayed. I'm sorry, the first assessment doesn't show what age, I think, just because that's an old one, but she was globally delayed in all the ways. We started immediately investigating that, including thorough genetic assessment, as Dr. Ayman said. We did the MRI scan, which was normal. We did all mitochondrial assessment, it was normal. Everything, okay, was all normal. So we don't know the reason for that. And we started the early intervention for her. I saw her again and the 24 months of age, and you can see this is here still delayed. At 40 months of age, she's still delayed. However, she started to progress. Now, this is what we say slow progressing. She's still really very hardly walk. She started walking at 2.5 months of age, and she's just not getting the balance. And fine motor slightly improved, but she does very well in the visual. She's excellent in her social interaction, and she tried to support herself, but she has a shaky hands, and her coordination is so poor. She developed in her language, but it's still not up to the line. So she's still delayed, but now we are focusing. The repeated assessment is just to focus on her disability and goes and try to improve her potential. She's under the follow of the metabolic clinic and the SKMC. Right, the second case, who's that one here? Right, I'm gonna jump this one, the more important one. This is a child come to me, basically referred at 9 months of age because of mother notes that he's doing very well, but when he crawls, he drags his foot, he drags his right leg. So he come to me, and during the assessment at the first clinic, I noticed that he's hypoparesis on the right side, and he also has a bit high tone. We requested the MRI scan, and he was having bronchocephaly on the left side. Immediately, we started his service, the required service, and I've been following him up. Now, I wanted to see when I saw him at 6 months of age, and if you look at it, he's age appropriate. And this is what I mean. When you do a development assessment, it doesn't mean anything unless you have a clinical picture. Because if you look at that one for any other child, you will never thought that this child has bronchocephaly. It's normal here. So interpretation must be linked to the clinical condition and the clinical presentation of the child. I continually see him regularly, 12 months, look at him. He's doing gorgeous, he's wow. He's still on line of development as if he is a normal child development. Some of them are actually more advanced. Again, at 24 months, the last I saw him, look at him here, the black dots. He's actually some advanced in the areas. I tell you, I have some videos for that child, but I don't have a permission to share it, unfortunately. He's 2 months of 24 months. He walks alone, he walks on a line, he jumps on his feet. He walks upstairs without any support, and he ride the tricycle. He's very talkative in his sentences. He asks questions, and he's such smart child, obviously with the parent support and with the input which is receiving. I'm going to go back to the previous one because I'm nearly done, because this is a very important. This is a child compared to the Amrani's one. He presented to me, she presented to me, unfortunately, after 2 years of age because of a speech delay. She's already diagnosed with hearing loss, and she has cochlear implant, which is unfortunately was implanted after 2 years of age, I think 2.5 or 3, nearly 3. Parents are not very much into getting the child into really seeing regularly by the audiologist, and therefore assessing the hearing aid. So this child is really having a main problem is that the hearing and following instruction, and also speech and language. Now, to me, this is a very good report for a child with hearing loss, because most of the children with hearing loss, the hearing loss has impact on all over their development. But she has strong potential. All she needs is a supportive family to improve her performance. So here's the 3 cases, the 4 cases, and my take-home message that the development system is really fundamental part of the child health care. And the standard tool using is really recommended, but still the assessment process has to be still considered as subjective, and taking into consideration the clinical scenario and the clinical part. It's a 360 review of a child. It's not a test. And you have to take all questionnaires, and you have to take a review from the parents and also from education. Picking up vulnerable children is emphasized in order to plan early for their appropriate support. Sorry for being late, and I'm done with my presentation. Thank you for you all.
Thank you, Dr. Huda. That was an excellent presentation and a very important one, because we all see patients and we need to be able to assess what they do. I have a few questions, but due to the time, I'm going to combine the questions, and I would like you to give 3 things that you think are the most important in increasing the child's intelligence, and also 3 things that you think we need to pick up and send the child for proper and thorough developmental assessment.
Okay, I will pick up the very important things. Number 1, nutrition. Nutrition, nutrition. And when I say nutrition, from the maternal time until the very early infancy. The second, stimulating environment. Stimulating environment can bring you up a very bright, excellent, smart child, can bring a very dumb child. And it's actually one of the causes of what we call catching down. So you see a child who's so bright, so smart, but then after years, well, he's not the smart boy as when he wasn't 3 years of age. And this is what we call the catching down. His ability has been really down. And the third important, education of the parents. It's so important. That will bring it up. What can bring down the children is our wrong practice and understanding of the children, how they develop, especially within the first years of life, and doesn't give attention to how much what everyday experience is affecting their, not now only in his development, but also in the future. The second thing is that not giving a direct attention to the child himself. Every child should have his own time with his parents and with his sibling, plus his free time. That will make his development. The third, don't stop the child from stopping the child from doing things which doesn't harm him, but doesn't like it by the parents. For example, playing up under rain or clay. Well, the parent doesn't like it, but for him, it's a really nice experience. It's a very important to make a sensation. Doing things which doesn't harm him and let him enjoy his childhood and his play, it's essential.
Thank you. Excellent summarizing. And